Okay. Hi, I'm Lily. I'm going to be your nurse today. I'm just applying hand hygiene. Can you tell me your name and your birthday?
My name is Christine Kamalang, December 1085.
Okay, perfect. And then I'm just going to check your wristband, make sure that you are who you say you are. And then we're just going to check the charting and make sure that you have an order for an IV, and you do. So we're just going to put an IV in your arm just to administer some fluids because you're pretty dehydrated. Is that okay with you?
Mm-hmm.
Okay, do you have any questions?
No.
Okay, do you have any allergies to anything?
Mm-mm.
Okay, and then I'm just going to shut the door for privacy, and then we would close the curtain if we need to. I'm going to gather all my supplies and be right back. Okay. And then I'm just setting up, oh, maybe she can't see, my supplies on the table. Oh, and it's over there. Okay, so I'm gonna come over here. We're gonna come this way. Okay. Maybe. It doesn't like tip down. Okay, well, that's fine. Okay, so I have my fluid. I'm going to check the medication record and just make sure that it's the correct amount of fluid that we're supposed to be administering. And that it's the right kind of fluid. And it does match the record. And I'm just putting my gloves on. Okay, and we're gonna get that all set up. Okay, and then this does have a cap on the end. And then I'm just gonna make sure that that's clamped so that nothing's coming out of it. And I'm gonna make sure to keep this tip clean so that I don't get it dirty with anything. Okay, and then I'm just gonna spike my bag. Awesome. And then I just want to fill my bulb up halfway with fluid. Okay, and that's about halfway. And then I'm just gonna hang it up on here. And then I'm gonna leave the cap on, and I'm just gonna go ahead and prime my tubing. Make sure that there's no bubbles in the line. Okay, and my fluid has touched the end, so I'm just gonna go ahead and clamp this off. And then I'm just gonna hang it up here. Okay, perfect. Okay, so we're just gonna move this back, oh, maybe, over here. Okay. All right, are you doing okay still?
Mm-hmm.
Okay. I'm just getting everything out and ready. Maybe we can, I don't know if you can see my table from here.
Can we lower it down?
We're just gonna come to this other side, I think. That's better. Okay. All right. So I am just going to put my tourniquet on and then fill for a vein on my patient. Are you still doing okay?
Mm-hmm.
Just tell me if you heard anything. Okay, I'm gonna make sure it's not quite tight enough. I want that to be pretty tight. Okay. And then can I just have you pump your fist a few times? just gonna look. I'm gonna put it down just a little further. Try not to break it. Okay, now go ahead and just pump your fist for me. Up. Good. Oh. Okay, so I can kind of see. Okay, she's got a good one right here that I can see and feel. So that would be the one that we're going to poke on her. I'm just gonna go ahead and get my alcohol pad and put some gloves on. Okay, and then I would just wipe the area. Okay, perfect. And then we're just gonna get ready to poke. I don't know if you can see that arm, not very good in that though. Come around this other way, maybe. Oh gosh. Okay. Very hard to see. Hopefully, maybe we'll stick her on the other side. Very hard to see. Okay, well, go back a little. Yeah, maybe right there. Oh, go ahead and just put it down.
Okay, down.
Well, yeah, right there. I don't know if you can see the flashback, but okay. And then, are you doing okay still?
Yes.
Okay, just making sure that my patient's comfortable. If they had any questions, I would answer those. And I've already alcoholed the arm, so I'm just getting everything ready. And I would want to keep my pad close in case they start bleeding. Don't need that. And I'm just gonna get everything ready. No, it doesn't want to open. And then get that ready. Just like that in there. Okay, and then I'm just gonna go ahead and hook my flush up to my saline lock. That way it's ready. And then I'm just gonna go ahead and scrub this for 30 seconds. Okay, and then we're just gonna hook that on. Oop, maybe. Okay, so that's ready, and then I have a cap on the other end for it. Okay, and then I'm just gonna go ahead and get ready, and again, just making sure my patient's comfortable and doing okay. I don't like the way this is positioned. I'm just gonna have the patient move their arm. Can you still see it?
Can you adjust the bed a little higher?
I think it's okay. Okay. Maybe come a little bit closer. That's good. Okay. And then we're just still making sure the patient's comfortable. So I'm pushing the catheter in and I'm already seeing flashback. I'm gonna go ahead and grab the catheter with my other hand and advance it while holding the needle with my other hand. And that's gonna go right into my sharps. And it is bleeding. I have to come closer. Okay, so you can see that I did get the vein. So I'm gonna go ahead and we're gonna pull that with a square and then go ahead and attach it to my patient. Yeah, you're good. Okay. All right. Okay. So still dripping. So I am just going to hold this down. So that is the vein that we poked. I don't know if you can. It's so on the wrong side.
Okay, hold on. Let me just hold it for you.
That
Oh, hold on. There.
Okay, and I'm gonna go ahead and, maybe pop my cap off if I can get the darn booger. Okay. I'm just gonna go ahead and pop my cap off. And we're just, gonna go ahead and twist it on, okay? And then if it were in a real person, I would go ahead and push the 3 mLs of the saline. But it's not. You still see it? Okay. All right. So I've pushed the saline. So I'm just gonna go ahead and unattach that. And then we're gonna go ahead and just put a secure over the hub. Oh, if it would quit moving. Okay, and we're just going over the little blue part. We don't want to bury the rest of it because we want it accessible. Okay. I'm just gonna go ahead and pull this off. And then I'm going to go ahead and initial and date it. And then we'll stick it back on. Okay, so we're just gonna initial and then put a date on it. And it was a 22 gauge. Okay, and we're just gonna go ahead and stick that onto our patient. Awesome. Okay. And then we're just gonna go ahead and tape the IV into place. So this is just to secure it even further, just so that if she moves or goes to the bathroom, it's not gonna pull it out. Go right up here. Okay, so that's just gonna kind of hold it down. And how are you feeling? Are you doing okay?
Mm-hmm.
Okay, perfect. All right, and then now we are just gonna go ahead and hook it up to the IV. Okay, so this has an alcohol cap on it, and then I'm just gonna go ahead and we're gonna scrub this hub again for 30 seconds. Okay, I'm gonna throw that away. And then I'm gonna go ahead and just trying to keep that clean still. Go ahead and take the cap off my IV. Oh, maybe off my fluids. Okay, and we're just gonna screw that on. And then here I would double check again the doctor's order just to make sure how much fluid we're gonna push per minute or whatever he's ordered for the rate. And then I would just go ahead and open my roller clamp here, which I'm not going to do, and adjust the flow rate, make sure everything's running properly. And then I would just check on my patient again in 30 minutes to make sure she's doing okay and that nothing's changed. We don't want to cause any harm to the patient. And I think that is all. So do you have any questions? Okay. You're all done. Oh. And then I would take my gloves off and perform hand hygiene. before I leave the room.